Well, all right, it is 3 o'clock, so I'm going to go ahead and welcome everybody to this afternoon's public safety referendum information session. Just for those on Zoom, please understand that we are going to go through our presentation first, and then all questions will be answered after the presentation. I want to thank everybody for being here in person and on Zoom, as well as thanking Chief Bump, Chief Roush, our city council members, and city manager Lemire for being present. With that said, I will turn it over to our city staff.
Thank you. Okay. So we will go ahead and go through the presentation. Thank you, President Scheer. So throughout the summer and fall of 2021, the city council and staff have discussed the need for additional public safety staffing in the city's police and fire departments. Chief Roush has requested to hire 6 paramedic firefighters and 6 advanced emergency medical technicians / firefighters to provide full-time 24/7 911 emergency medical services and firefighting services. Chief Bump has requested to hire 2 additional sworn police patrol officers to allow more proactive policing in the city. Also recall that the city is limited in the amount that can be added to the property tax levy by the city's percentage of net new construction. In 2021, that net new construction number was 0.349%, which resulted in an allowable levy increase of $18,000. The city does not have funds available nor the ability to increase the property tax levy to the extent necessary to fund these additional positions and city services. So on January 18th, the city council approved a resolution putting a public safety referendum question on the April 5th, 2022 election ballot to ask the city's voters if they are willing to pay additional taxes so that the city can hire additional staff to provide these services. First and foremost, I want to thank the city council for their support of our proposals and their willingness to ask the voters to approve a referendum question, which will raise their own taxes in order to fund these proposals. I also want to thank Chief Bump and Chief Roush for their diligence in working to identify solutions that will continue to ensure Fort Atkinson can provide its residents with high quality services into the future. The need for additional full-time public safety personnel is based on the increasing calls for service, the increasing complexity of those calls, and the outdated staffing structure in the fire department. Despite these increasing needs for services and personnel, funding sources available to the city remain stagnant or are decreasing. There are 2 main funding sources for local governments: property taxes and state shared revenue. Together, these 2 sources make up 88% of our general fund revenue budget. Property taxes are limited by the state through levy limits, hence the need for a referendum, and state shared revenue has declined statewide by over $200 million since 2001, while income taxes continue to increase, creating a significant budget surplus at the state level, which I'm sure you've all heard about recently. Many people in this community do not understand that our fire department is made up mostly of volunteers who leave their jobs, homes, families, or beds to respond to calls. There are 4 full-time fire personnel currently, Chief Roush and 3 division chiefs. Together, they staff the fire department with 1 person 24/7. We rely heavily on our volunteers, as 1 person cannot respond to a call in a fire truck or an ambulance. While this model has worked in decades past, when call volumes were lower, it is simply unsustainable to rely so heavily on part-time volunteer staff given the growing and current anticipated future demand for timely fire and EMS responses. The police department, which includes 20 sworn officers, has had nearly stagnant staffing levels for the entire 21st century. In the last 2 decades, the need for police services has not been stagnant. It has been increasing. This becomes apparent when we look at how officers must spend their time. In a more ideal scenario, 60% of officer time would be dedicated to responding to calls, while 40% would be addressing community challenges and maintaining availability for serious emergencies. This is known as the rule of 60. In 2021, Fort Atkinson patrol officers spent an average of 78% of their time responding to calls and only 22% of their time on the more proactive side of policing. The takeaway is clear. Current staffing levels are too low for officers to be able to provide sufficient proactive policing services to our community. As I mentioned, increasing calls for service are a primary driver for the need for additional funding to support full-time fire staff and additional police officers. In 2021, the fire department was called to respond to more than 500 incidents for the first time. This is a drastic 108% increase in calls for service since 2010. This increase in calls has decreased the number of volunteer staff willing and able to serve the community. Volunteers are strained by having to leave their regular employment or family functions to respond to emergencies, and some simply cannot. On the police side, in 2020 and 2021, they have been some of the busiest years on record for our police department. In fact, the Fort Atkinson Police Department responded to nearly 4,400 additional calls in 2021 than it did in 2010, which is a 42% increase in calls for service. The chart on this page shows the police department increase in calls for service, which is the top line, and the stagnant staffing level, which is the lower line. So in addition to the increase in the number of calls for service on both the police and fire sides, the type of calls that police officers receive has shifted. The police department has to respond to an increasing number of complex calls regarding sexual assault, domestic violence, alcohol and drug-related issues, and mental health crises, straining officers' time and ability to respond to additional calls that come in while pulling them away from the proactive policing duties. While some calls can be responded to promptly and handled in 10 minutes or less, other more complex issues may take between 6 and 18 hours to manage. Since the mid-70s, the Fort Atkinson community has nearly doubled the number of annual calls for service from the fire department. However, the department has had stagnant staffing. Calls falling during the workday can be hard for part-time volunteer staff to respond to due to work and family commitments. In 2020, 70% of calls came during the work week, and 71% of calls were logged between the hours of 6 a.m. and 4 p.m. Having full-time EMS and fire staff on site at the fire station would decrease response times. Currently, on average, it takes 7 minutes for volunteers to get from their place of employment or their home to the fire station after a call comes in. This is known as rollout time. Then it takes an additional 4 to 5 minutes to get to a call location within the city. Adding full-time staff to the department would reduce this rollout time to just 90 seconds. City staff have worked closely with the fire department to think long-term for our residents and determine how best to ensure our community has access to high-quality fire and emergency medical services. At present, our critically urgent need lies on the fire side of the fire department. We cannot continue as a volunteer-reliant department. Just adding full-time fire staff would not work. Instead, bolstering our fire service with full-time staff cross-trained in EMS is the best, most sustainable option to protect the long-term future of our community. That cross-trained staff operating out of the fire department will generate revenue to help it sustain the fire service by reducing our reliance on burnt-out volunteers. Currently, the Fort Atkinson community calls for about 1,250 ambulance responses per year, but just one ambulance is available per day in Fort Atkinson. Our proposal includes 2 ambulances dedicated to 911 EMS service in-house at the fire department. Costs for the municipal service would be controlled by the city council and set through an annual fee schedule. Through a municipal service, we can increase the level of service to patients while decreasing the patient cost for service. So why do we need to go to referendum now in order to increase funding to support these additional public safety services? The city has explored other options, and a referendum is the only one available without drastic cuts to current personnel and services in other departments. This is the technical language and structure of the referendum question as required by state law. I won't read it to you, but this is what it'll look like on the ballot on November 5th. We'll go through a couple of these numbers for you, though. The $7,871,614, that is the estimated total tax levy for the city in 2022. And just so everybody's aware how this works is the tax bills are sent out in December of 22. They are due in 23, and the revenue from those tax bills pays for city operations in 2023. So it says for the fiscal year 2023, but you would receive that tax bill in December of 2022. So that is the estimated total levy for the city for the fiscal year 23. The 0.349% is the net new construction number from 2021. That is the number that the State Department of Revenue asked us to include in the referendum question because that was our net new construction last year. That would potentially be what we would be permitted to increase the levy by in 2023 without the referendum. So $8,640,949 would be the total if the referendum is approved. And the difference is that $769,335. That would be the amount that the city would be permitted to add to the tax levy annually in the future. There's no escalator, there's no sunset on that. Other parts of the city's levy equation may increase in the future, but there's no escalator on that number. So that just as on your tax bills, I think now you can see a school district add-on from a referendum at the bottom of your tax bill. This is the add-on that you would see if this referendum is approved. And there is only one question on the ballot because it includes a total levy for 2023. If there were 2 or even 3 separate questions on the ballot, only one could pass. The question must be yes, no per state statute, and there is no way that we could guarantee only one question would be approved while the others would fail. So if the referendum is approved by a majority of voters on April 5th, the city of Fort Atkinson will be able to add 6 full-time firefighter paramedics, 6 full-time firefighter EMTs to the fire department, and 2 additional police officers to the police department. If the referendum is approved, the annual property tax would increase by an estimated $88 or $82.22 per year for every $100,000 of assessed property value, starting with bills issued in December of 22. For example, the impact to a property valued at $160,000, which is the average assessed value of a single family home in Fort Atkinson right now, would be $131.55 annually, or $2.52 per week. $100,000 is included on this as an easy multiplier, and then $160,000 is the average assessed value in the city. Now I'd like to show you this chart, which compares costs for a couple different types of operational services. I will say I won't call them options at this point because we are seeking this referendum. It is on the ballot. It cannot change at this point. This table is just for comparison purposes. The far right column, this is the option we proposed through this public safety referendum, adding 2 additional police officers, 12 full-time cross-trained fire department and fire and EMS staff. It also includes revenue, and then the projected tax increase of this proposal, as indicated on the last slide, is the $82.22 per $100,000 of value. Moving, going back over to the left-hand side, that first alternate would be to hire 2 police officers, hire 6 full-time firefighters, and maintain an EMS contract similar to what we have. The cost of that would result in $90.04 per $100,000 of assessed value. So as you can see, even with the existing contracts and existing services, just adding firefighters and 2 police officers is more expensive than adding 12 cross-trained firefighter and paramedics or firefighter EMTs because of the revenue offset. The middle column is an increased EMS contract cost that is hiring 2 police officers, 6 firefighters, and contracting EMS to the level that we are providing with our proposal, which is 2 911 dedicated ambulances. As you can see, that option in the middle is the most expensive at $116.76 per $100,000 of value. So as you can see, the proposal included in the referendum question offers improved police service, improved fire service, improved EMS service, and is the lowest cost. This is what you'll be voting on April 5th. If the referendum is rejected by a majority of the voters, the city will be faced with difficult decisions about how to address the growing need for public safety services. A no vote is not a status quo vote. Staff would have to consider requesting proposals for 911 EMS services, possible drastic reductions to other departmental staff and services, and or another referendum in November of 2022. We can start with the question we have too, if you want to kick it off that way.
Will do. Thank you, City Manager Lemire. All right, so just for everybody's reference, we will be answering questions at this point. We will start with anybody who has signed up in person, and then we will switch between in-person and Zoom questions for the remainder of the hour. We will go until 4 p.m.
You can go ahead and start one just to kick off with the police department question. In an agency of 20 sworn officers, what impact will 2 additional officers have on the department and operations?
I think a lot of people might think about, well, just adding 2 officers, what kind of impact will that make? Well, it allows our agency to go from 12 patrol officers to 14 patrol officers, and that covers first, second, third shift, so 24/7. Adding just 2 additional officers will allow us to deploy our resources in a manner that will allow us to go from having 2 officers on the road at a time to 3 and mostly 4 officers on the road at a single time. The majority of our busiest times between 6:30 a.m. and 2:30 a.m., we would have 4 officers on the road compared to right now where we have 2. I think a lot of people would be amazed to think that a community our size of almost 13,000 only has 2 patrol officers that are covering the entire city. But that's what we've been going with for the last 20 some years. So we're policing in a model from early 1990, 1998, and the world has changed a lot since then. So adding just 2 additional uniform patrol officers makes a big impact on how we deploy our resources. And it really does increase the amount of officers on the road every day.
Do you mind if I add something, Chief? I was just going to add, while I was running for council, I did a ride along with one of our police officers. So I spent about 4 hours with an officer just to learn more about their job and get a better idea of what they do. And I can assure you these officers would not be added so that there can be more police on the streets issuing speeding tickets. I was blown away by the breadth and variety of things that these officers are doing on any given day during their job. In the 4 hours I spent with Officer Dunkelberger, he responded to a local business to check security cameras for an issue that had taken place the night before from another officer. He helped an individual unlock their car, which is still a free service that our police department offers. He responded to an emergency call at a local hotel. We responded to a car accident. He stopped to take a picture for a life-saving situation that he and a couple officers had been in the week before. I was pretty amazed by the extent of the work that they are doing and can fully understand why that additional support would be needed. But I would encourage you guys to look. Chief and his team do a great job of sharing videos of the day in the life of an officer, and check out their Facebook page and go look at those videos to really get an idea of what those individuals' jobs really look like every day.
More that we would like to use, or we would like to? Okay.
The first person signed up today is Todd Overdahl. If you can come up to the podium, you're allowed to ask one question. Have you state your name and address, please?
Todd Overdahl, 620 Washington Street in Fort Atkinson here. I guess my biggest thing with this referendum is that we're grouping 2 different departments, which are under the same auspice, I understand, in public safety. But it's also affecting 2 different sets of groups, just the city of Fort Atkinson. And then the EMS portion of it is going to affect also the townships as well. So we have a referendum that the city is voting on that the townships have no say in. And we're also making it so that it's either all or nothing. And I don't see how, if the city of Fort Atkinson believes that everything is as it should be and they vote yes, how the townships, even though yes, they have given you the authority to make changes, but don't get the right to vote on this. And like I say, it's affecting two separate response areas. It's not just all just for the city of Fort Atkinson. When you change the EMS contract portion of it, you're also affecting the townships as well. So how are they not getting a vote in this? And how is it the city residents are the only ones that get this vote for this referendum when you have, they're going to be affected as well?
Sure. And if, excuse me, this is Manager Lemire. I think people on Zoom are struggling with understanding who's talking. So if when we begin to talk, just we'll mention what our names are. So Manager Lemire here. The towns, you are correct that the towns do not have a say. They do not live in the city. The town residents, or the town boards, I should say, would have the opportunity to negotiate new contracts with the city for EMS services if the referendum passes. And we have had communications with the townships indicating that their contracts would stay relatively consistent as far as the cost of those contracts for at least the first 3 years of a new partnership together.
Okay.
Thank you.
Thank you. Do we have any more signed up for in person?
Cody Letson.
Hi, everyone. Cody Letson, 3740 East Jacobs Drive. I just wanted to start out. I've been getting a tremendous amount of questions because of my position from people in the community. So if you don't, I'm just gonna tell everyone who I am and why I came up here to speak, and then I'll ask my question if that's all right with everyone. So my name's Cody Letson. I'm the current service director for Ryan Brothers Ambulance. We do the EMS here. Currently for the city of Fort Atkinson. As I said, I've had a lot of you reach out to me with questions about what's going on, what's happening and why. So I just want to give you guys a really brief background of my position and what is going on with us. So first off,
Cody, this is
yeah,
this is information
Yeah.
for the city, not for Ryan Brothers to have a platform to speak over.
okay.
Do you have a question for us that we can
Yeah, I
answer?
do then. That's fine. So I seen you guys put the slide on with the,
I will say that if you want to hear Cody speak, you can, you're more than welcome to gather a crowd outside after 4 o'clock, but this is our informational session. So if you have a question, we will answer questions.
Okay. I'm disappointed, but that I understand. Okay, all right, thank you. No, so I see the new slide with the estimated cost comparisons that you guys used. Obviously, I'm the service director for Ryan Brothers. We've been here for the last 20 years. So I guess my question to you guys is, in that comparison, you showed a value of what it would cost to increase contractual service with your current provider. Because I've never been asked to provide an estimate of cost increase to service. I've never been asked to provide any information in that regard. What was the number that you guys came up with on your own, and why was I never approached or asked to weigh in on this process?
I can actually answer that. In February of 2017, I met with Ryan Brothers with Rob Lulling and Aaron and Patrick. At that point, I communicated that I thought this community needed a second dedicated 911 ambulance. At that point, Aaron told us that we could have as many ambulances as we wanted for $250,000 a year each. I then, in 2018, when we were building the new station, I approached Ryan Brothers about moving their operation into the new station. The response was that they would move 736, the primary unit there, but they were going to add a third unit in their facility. I then requested that if one of those new units would be dedicated for 911 service. And again, I was told if we wanted a second dedicated 911 ambulance, we would need to pay the entire cost of that unit's operation. So neither of those were fundable without going to referendum. Okay. The plan that we're putting forth provides 2 dedicated 911 ambulances that will serve this service area, will not be involved in interfacility work. So in our determination is the best model in order to do that is to go to referendum and provide that service.
And that table did include the $250,000 as referenced by Chief Roush.
Okay. So just a follow up with that then. Obviously that was 5 years ago and several of those people are no longer involved. I've been the service director for about 3 years now. Was I ever approached by anybody on this council to provide an estimated cost for increased service?
I did not approach you in the last year.
Okay, thank you.
I will just add, we've adequately answered this question before, but just for folks who have not attended those meetings or listened to those Zoom calls, part of it is because we are not just looking at a comparison between EMS A and EMS B. This is a part of a bigger solution to address mostly our fire staffing model. So it isn't a, what is it going to cost Ryan Brothers or what would it cost us? Because this isn't an apples to apples comparison for us. EMS is part of a much bigger solution that we need to be bringing in to address that fire staffing critical issue that we have right now.
Do we have any questions from Zoom participants?
We do have a question on the chat. I'll read it out loud. It's years ago, and this is a question from David. I believe it says Magnuson, but it's a little bit cut off. Magzaman. Okay, so years ago there was an AFH CBRF memorandum due to the strain on the police department. Hiring more officers was not an option. What has changed since then? Also, if I am reading the information correctly, will 2 officers be hired regardless of the referendum result?
So back when we started the CBRF, or the community-based residential facility program, where we tried to reduce calls, that was in response to when we started seeing a large increase in calls for service related to that population. So that's about 3 to 7% of our population, and we were spending an extreme amount of time with those. So we initiated a problem-solving initiative along with all of the group homes and CBRFs in the city to try to reduce calls that were unnecessary, or calls that should be handled by those businesses instead of relying on public safety to take care of it. So we worked really hard to reduce calls, and in the end result was, although we helped some of the facilities become better managed and have better policies, we did not make any impact in reducing calls for service. They actually increased. So now we have even more calls. At the time, under the current situation the city was in and the financial situation, that time it was told to me, we do not have the ability in any way to hire more officers. And that's where we were at the time. So there was no change. And this referendum, if it does not pass, I don't believe that there is any opportunity for the city to have funds that can hire 2 more police officers based off of what's available financially for the city. So that's why the officers are added into this as well, because there's a total public safety need in all areas for the city. And I'll let someone else answer part of that as well.
Sure. So I can tell you that if the referendum fails, we will not be hiring 2 additional police officers because we would not have space within our levy limit to hire any additional staff. As I referenced at the beginning of this presentation, our levy limit allowable increase in 2020 for 2022 budget was about $18,000. As you can see from the previous slides, 2 police officers cost about $200,000.
Would anybody in the audience care to ask a question? If so, please address the podium, state your name and your address.
Jim Kaler, 112 East Milwaukee Avenue, Fort Atkinson. So just to follow up on that last question, are these addresses that have multiple calls, have they, or are they currently being assessed, or is there a financial stake to having multiple calls to an existing address?
Part of our process when I in around 2016 was we started identifying properties or locations in the city that were a strain on public safety resources. And that's when I went out and drafted an ordinance that would hold those locations accountable if they reach certain levels. And that is our chronic nuisance property ordinance. So if we have a home or a business that continuously has calls for service that are chronic and nuisance related, we can start billing them when they reach certain call volume numbers, and it's all drafted out in the ordinance. So they, if we go there for a disorderly conduct and the officers have to make an arrest, issue a citation. In addition to that, there is also a fee structure that goes with it, and they get billed through City Hall for police services through a set amount based off of how many officers and how much time they spent. So I do actively bill locations in the city that have qualify within that ordinance. And we have some, group homes that fall into that once in a while, and it goes on a rolling calendar. So if they're at that level, but they kind of fix things and make it better and we don't go anymore after time, then they fall out of that chronic nuisance category as well. So fines and billing does occur, correct?
Are there any questions on Zoom?
We do have another follow-up question from the same individual, if you'd like to take that one. There was a major increase in service needs over the last 2 years. How much of that can be attributed to the pandemic, no in-school attendance, work closures, etc.? How many of the increased calls could have been handled by social services?
It's hard to say what the impact is. We see a trend of increasing calls over the last 10 years easily. And you can see that in the last 10 years, we've increased 42% in our call volume. If you look at 2019, 2020, and now 2021, those are our busiest years in the history of our police department. You look at this year now, where I think we're kind of falling outside of that COVID, we're kind of just falling off. This year, check the numbers this week, and we are currently 9 days ahead in call volume of where we were last year, which last year was the busiest year in the history of our police department. So we're already beyond that going into the new year. Why are these things occurring? Some of the things that we're dealing with are domestic violence related, alcohol and drug related, mental health crisis definitely calls for a lot of what we do every day. And then, we live in a community that has things that draw on police services continuously. Having a very large school district, it calls for police presence and assistance at all times throughout the day. Kids are also in crisis. Kids also bring their problems to school with them, and we have to help with that. We have a hospital with a very active and busy ER that brings in patients and customers from all the communities around us. And things that occur in the ER fall on our shoulders to address, at least initially, a lot of times. So that's another area where we spend a lot of time problem solving and assisting hospital and ER staff that draws on what we do every day. So there's all kinds of things that we're doing. And the last thing is, if you look at when I became a police officer in 1998, the job of being a policeman in 1998 compared to the job of being a policeman in 2022 are completely different. And that's another reason why we have such an increase in call volume, because the expectations of our community are very different than what they used to be. And we're policing in a model from 1998 with the same level of resources and manpower as 1998 in a world that has expectations of 2022. And that's where we're seeing the biggest problems and the biggest demand for our time and our services.
Can you touch on what an average call is for response, and I guess the time lengths that are included on that?
So we could talk about something as easy as a traffic stop. Usually those are proactive, but not always. A traffic stop on average, 9 minutes would be a good number. Dealing with someone with a mental health crisis, which is the exact opposite of the spectrum. If we're lucky and we can deal with it and move on, it might be a 30-minute call. But if they're going to the hospital and then beyond that going to a secure mental health facility, those calls usually take anywhere from 8 hours to even up to 16 hours. And we know that an officer works about an 8-hour shift. So you know that the officer is starting that at some point during their shift, passing it on to another officer or staying through to the end. And then when they're done, still having to do the paperwork that follows up with it. We've had a few calls in the last 6 months where it's one officer, mental health crisis of a person, 16 hours. And that is not exaggerating even a minute. And it's pretty amazing. So.
Chief Bump, could you also touch on the social work aspect of the question and what our department has done?
Yeah, it's a good point. A lot of what we do is dealing with people in crisis, and us adapting to that and doing everything we can to be there to always provide value. Our agency is probably one of the most forward thinking in this area. We have all but 2 of our officers are trained in crisis intervention through NAMI, which is a national program. And we hope to have those last 2 trained at the end of the summer and be 100%. Our department was one of the first in the state to be dementia friendly rated. And all of our officers and all of our dispatchers are trained in dementia response, and then also autism response. And then on top of it, we've entered into a pilot program with the Jefferson County Human Services, and we are the only police department in the county that has a social worker that works out of our police department. She is actually in the building, in the department 2 days a week, but a resource to us every day, obviously, but actually is in the building and will respond to calls with officers if needed. And that is done at no cost to city taxpayers through our budget, as it's provided through the County Human Services as a pilot program. And we hope to sustain that as long as we possibly can, as long as we see value in it and Human Services sees value in it. And so we'll kind of see how it goes. But to be able to have that and be the only department in the county that's doing it, I think shows that we're always thinking forward. We're always working forward to always provide a little bit more value.
Thank you.
Should we go on to another slide question? It's another slide question here for the fire department. How many full-time staff members will be on each shift? What do those shifts look like? And what will people be doing if they are not on calls?
Okay, well, the staffing plan calls for 2 staffed ambulances. Primary ambulance will run approximately 1,000 calls a year. Secondary ambulance will only run EMS calls when the primary unit is busy. Those other 2 people will also staff an engine company, which will reduce calls to our volunteers by over 200 calls a year, because they will be able to handle many routine fire incidents, as well as providing the depth of staff for the second EMS call. Total staffing will be the 4 firefighter EMS personnel, plus the division chief, who is currently staffing the station. So minimum staffing will be 5 each day. And that will allow us to handle a lot of those calls, all of the EMS calls with a few rare exceptions when 3 ambulances are needed simultaneously. Last year that happened about 25 times, and also handle at least 200 of the current fire calls, which are amounting to around 400 calls a year. So it reduces our stress on the volunteers by reducing those number of calls that they would be asked to come for. What will they be doing when they're not on calls? Currently, we contract a lot of our maintenance, vehicle maintenance, equipment testing. So we'll be taking a lot of that back in-house, which creates about $30,000 a year in contract savings. Taking care of the janitor work at the building, doing fire prevention activities, which currently we're very limited on how many prevention activities that we can do using volunteers. So I would expect that our prevention activities would expand. They'll also work on providing training for the volunteers, making sure the training program is prepared so that when the volunteers come in the evening for training, that they have good quality training. And our community paramedicine program will assist residents with staying in their homes longer by providing them with help with their medications, helping them just stay home and not having to transport everybody to the hospital. By and large, private EMS services tend to be driven by profits. So a lot of people end up at the hospital that maybe don't necessarily need to. They just need a little bit of help to be able to remain in their homes longer. Doing blood pressure checks and helping them with sorting their pills and just helping them make their home safe. All of those things are part of a effective paramedicine program. And we certainly, with that second unit not running as many calls, we'll certainly have the ability to provide that service.
Chief, can you talk about, so obviously having full-time staff members will reduce the burden on the volunteers. What does a current year look like? What does a current year look like in the life of a volunteer firefighter?
Well, if you're an average firefighter in our department and you're not part of our rescue, so should explain, we have fire only members, we have fire rescue members, and we have fire EMS members. So the fire only members spend about 600 hours a year responding to calls, going to training, taking care of some help with some of the equipment maintenance. The fire rescue members currently respond to about 1,000 hours a year. And that includes significantly more calls. Last year, we had almost 200 rescue calls. And this year, we are at, for the first 2 months of the year, between rescue, 19 calls for rescue and 39 calls for EMS when Ryan Brothers was not available. And if you're a paid on call officer, a volunteer officer, you can add a couple hundred hours more per year for administrative roles that they help us with. So anywhere between 600 and 1,200 hours a year, which is 1,200 hours is more than a half-time position. And we're expecting them to do this as volunteers. If you don't need to take my word for this, talk to the volunteers and talk to their families about the stresses that we're creating on their families. And I have a firefighter whose birthday was last Saturday. His family went out on a day trip. He stayed home and did 9.5 hours of homework for an EMT class that he's currently in on his birthday.
Chief, could you also, I saw a few people not maybe fully understand some of the community paramedicine things you were talking about, who perhaps don't understand that those are things that currently the fire department is sometimes called for. So can you just give some examples of, outside of a building being in flames, what are some of the other things that your department is being called out to take care of for our community?
Actually, we really shouldn't even be called a fire department anymore. We should really take down the fire department sign and put up the everything else sign. When I started in this business 40 years ago, unless there was smoke coming out of a building, we never left the firehouse. Today, we go weeks at a time without responding to anything that even resembles a fire. So everything from car accidents to carbon monoxide calls to cats in trees and ducks in the river and helping people with medical calls, assisting EMS. Any cardiac arrest calls we're called for to assist the private service. If the private service isn't available, we're called. All that's part of what we do, and it is called out specifically in the contract with the private provider. We're happy to do that. But we talk about the warehouse fire that happened last August. That's really an anomaly that we have an incident that size. A lot of the things that we do can be handled with one truck and 3 people. And we say that 90% of what the fire department does can be handled with 1 truck and 3 people. A lot of it's very routine. A lot of it's not time critical. Even yesterday, we had a 2-car accident north of town. I got there within about 4 minutes. The engine got there in about 10 minutes. But really, there wasn't a significant need for emergent response because the individuals that were injured in the accident were not severely injured, although one was trapped in the car and had to be extricated. But if it took 5 more minutes to do that, it's not a big thing. What is time critical is when there's a fire in a house or there's somebody who's got a medical emergency, then time does make a difference. And right now it takes anywhere from 7 to 10 minutes to put a fire engine on the road using volunteers because they have to come from wherever they are to the station, and that takes some time. More than 20 of our members live south of Hackbarth Road. So imagine the time that it takes to drive from Hackbarth Road to the fire station. And that's all part of the total response time, what we call reflex time. And reflex time is the time from when the 911 dispatcher picks up the phone until the fire truck arrives on scene and somebody does something to make the situation better. That's, we call that reflex time. So unfortunately, right now, that total reflex time ends up being, in many cases, more than 10 minutes to get a resource on scene. Okay. If you have a fire on your stovetop, it's a fairly routine incident. But if you can't put that fire out and it takes the first fire engine 10 minutes to get there, that's probably not a stove fire anymore. Now it may be a kitchen fire, or it may be your house is on fire. And I can tell you a number of homes in this community that have had significantly more damage than they should have had because of the delay that it takes to put resources in front of the house when that occurs. There's one house south of town on Highway 12. When I arrived there, the fire was in the garage. This was at 12:30 in the morning. Since I live on the south end of town, I was there within about 4 minutes. Had I had a fire truck with me, I could have put that fire out in the garage and the house would have been saved. It took 13 minutes for the first fire truck to get there. At that point, it was already in the attic of the house, and before the incident was over, we ended up tearing the house down. There is a new house there today. But that's when we're talking about property. But when we start talking about lives with people trapped, I can tell you the difference between a 4 to 5 minute response time anywhere in the city having full-time people and 10 minutes response time in the city using volunteers. That's the difference between saving somebody and not saving somebody. That's why, in my experience and all of the experience that I've had over all the years, I believe that this is the best course of action for the community at this time.
Thank you, Chief Roush. Just to be fair, I know we have a few questions on Zoom, but I will open it up. Is there another in-person question?
Hello, everybody. Rusty Gross, 1117 Grant Street. Food for thought. How about if we offer 9 internships to students who are studying fire protection at like Madison or Milwaukee? We got a big safety program at Whitewater. 9 guys, you'd have 9 guys in the fire station at night, Monday, Wednesday, Tuesday, Thursday. So you could always have, 3, 4, 5 guys, state statute, 4 guys out on the first engine company. Works good. The reason I bring that up is that when I graduated from Fort Atkinson, I received 2 Fort Atkinson community scholarships to go to fire school. And thank God for the city of Fitchburg. The residents of the city of Fitchburg offered me an internship there. So Monday, Wednesday, Tuesday, Thursday is when guys flip off to go to school there, if it's still that way in Madison. So when I was a full-time firefighter in Oklahoma City, my station, we had 9 guys in. So with the internships, you know, you're always going to have a guy out with his girlfriend or something. They're college students, but very well staffed, 9 guys.
I can answer that question for you. I actually proposed that to both MATC and the Blackhawk Tech. No, neither college was interested in working with us in an intern program unless we had EMS in-house. Because that creates the experience that the new person going to school to be a firefighter today, if they're going to get hired with the career department, they're going to need to be fire and EMS.
Yeah, and
So-
that was the same way at Fitchburg. And
So-
they sent me my first EMT certification with St. Mary's in Madison, and that was done right away. Then the next year, the second year, I was nationally certified as an EMT. And then in Oklahoma City, I went to paramedic school.
And
So-
both, that plan is part of our long-term plan. If we bring EMS in-house, is to
Well, we
start an
should,
intern
'cause
program.
this was identified, Mr. Becker, several years ago that, and again, I'm very appreciative for the contract ambulance. You guys have done a great job. And before I forget, Mr. Bump, I'm very glad that your 2 officers were able to convert that person, whoever that was, some odd months ago. Do you guys carry AEDs in your cars? Yeah. Very fortunate that they were able to convert that. That is a wonderful thing. I know that feeling. It's a wonderful feeling. But yeah, you could easily, because it's nothing to go to EMT school. St. Mary's put me through it in no time. And so yeah, I mean, it's food for thought. And again, with my 4 community scholarships, I got 1 each year. Usually you're only supposed to get 1, but because I got a second one. And I'm very thankful to the citizens of this community, because between that and my internship at Fitchburg, I graduated with no debt. So this is, and plus you're getting highly skilled in hazardous materials. And these guys are not just off the street. And usually they come from volunteer family backgrounds. So if we do go the full-time route, certainly we want to have an eligibility list like we do with the police department. We've got a lot of guys coming back from Afghanistan and Iraq, veterans who are very skilled at trauma. And we certainly want to open it up to people from the Chicago Fire Department, Milwaukee, Madison. Maybe they want to get out of the big town, come to Fort Atkinson and be a fireman. So we want to have an eligibility list. Again, nothing with me, I'm retired. But so yeah, food for thought. I want to let other people talk here.
Yep, no
But
worries.
definitely food for thought. I cannot tell you what a great experience. And plus the people of the city of Fitchburg were very appreciative, because they were in the same situation that we are now.
Mhm.
And with the interns there, I mean, it really helped. They're full-time now, but in that transition where we are right now, it saved the taxpayers a lot of money. I'll check with the programs and see what viability that is, because I want to let people know my experience. Thank you, Mr. Becker. Thank you for hearing me. Thank you.
Thank you.
Appreciate it. Thank you. And I know that if a full-time route does come through, that we are fortunate enough that a lot of our volunteer firefighters would look at moving into full-time positions. We do have time for one more question on Zoom, and then I want to give some time to our council members if they have anything to add. So do we have one more question on Zoom?
One of the questions on the chat is, It's maybe too early to say, but it seems that the Banker Road development will add tax base, but not soon enough to impact the current issues. Is there a projection how the added subdivision will negatively or positively impact this current issue?
I think the build out of that subdivision is realistically 10 to 15 years out. So I don't think we could bank on any immediate positive tax impact that would allow us to hire the amount of staff we would need to in the time frame we would need to create the viable service. So, you know, that the taxes, the additional taxes or the additional tax base created from that development would be more of an incremental change. So if we do have 400, 500 additional residents there in 10 years, and that necessitates one additional police officer or one additional firefighter, the tax levy may be able to absorb that at that time, but we would have to have the system in place to hire that person. So it will, long term, it will have a very positive impact on all of us, but in the short term, it would not impact what we're doing on April 5th.
Could I add something to that? Just to be clear, we are not talking about transitioning the fire department from a volunteer department to a career department. What we're looking at is a basic level of staffing to handle those routine calls. The volunteers are still going to be a very important part of our organization. We think that this proposal gets us 10 years down the road before we have to look at any future staffing changes. But the volunteers are always going to be important. And I've mentioned this many times to the firefighters that we are still going to be a volunteer department. We're just going to be supported with a few more full-time people, much like we are now. I mean, the four of us that are there full-time, our roles are primarily administrative. We take care of the mundane daily tasks that have to be done, report writing, the ordering supplies, the answering the phone for the routine things. We still have to have the volunteers for virtually everything that we do. Having these 5 people on shift every day reduces those routine calls. It also helps with some of the routine administrative stuff that we're currently doing today and some of the contracted stuff.
Thank you. If anybody did not get a chance to ask a question and you still want to ask a question, I urge you to either ask us after the meeting or to email referendum@fortatkinsonwi.net. We also have a plethora of referendum information available at fortatkinsonwi.net. So if you do have questions, we have resources. We want to have these conversations with you. In the last couple minutes, I will keep my part brief. We would not bring this before you unless we had to. The time is critical. This is something that has been known for a few years, and we've hit that point where we are trying to be as proactive as we possibly can. The last thing we want is for a true crisis in our community where you call for emergency help and it is either extremely delayed in getting to your emergency or doesn't show up at all. We don't want to see that. This is a solution for us to provide the best service possible to you, the residents, and ultimately we are asking you to make the choice. So please find accurate information, reach out to us. We are more than happy to have these conversations. Any of my other fellow council members?
Yeah, if it's okay, I've been quiet today and I appreciate how many people turned out here today. I didn't know 3 o'clock on a Wednesday afternoon. I didn't know what kind of turnout we'd get, but I'm very happy that so many residents were willing to come here and listen and give their thoughts and also attend online. I appreciate that. I know this isn't a fun thing we're talking about right now. I know that all of us are dealing with inflation. We're paying more at the grocery store. We're paying as much at the pump right now as I've seen only a couple other times in my life. And I know it's not fun. I hate that we have to be so beholden to the property tax. I've had residents ask me, can't you come up with another revenue stream? Isn't there another way to fund this? And the truth is there's not. The state government simply doesn't give us any other options for funding our basic needs. in terms of our state government, I'm not going to go on a screed about them, but in other states, the state government does do a lot of the funding for police departments. Wisconsin is dead last out of 50 states in state funding for local law enforcement. That's just a fact. Comes from the Wisconsin Policy Forum. Fire departments, I don't know why, but they're an essential service. Everybody acknowledges that, but we expect them to do fundraising for a great amount of their operational needs. Unfortunately, we're at the point where I don't think the Fort Atkinson Fire Department can have enough pancake breakfasts to cover adding 12 full-time firefighters. It's just not realistic. I will briefly quote from a post I saw show up on my Facebook page today, or my Facebook feed. This is from Ryan Wisner, the former reporter from the Daily Union. He made this a public post, so I'm just going to very briefly read from it. Fort Atkinson Fire Department is facing a crisis. Currently, the department operates with the same staffing model which was used in the 1950s, consisting of 3 full-time firefighters, a full-time chief, and 36 to 40 paid-on-call firefighters. These are dedicated individuals who leave their own jobs to put out fires in your homes, pull you or your loved ones out of a wrecked car, and provide emergency care in the event of a stroke. He goes on to talk about just some challenges with ambulance responses and so on. The date of that post was March 9th, 2016. So this is not a new problem. This is something we've been aware of and that's been building for a while now. And I can honestly say the city government has tried to address it. You heard about some of our challenges with CBRFs. We have per capita the highest amount of CBRF or adult care beds in the entire state. That's just something that's built over time. Is it a burden to our emergency services? Yes. But I think it's also something to be proud of, that we've become a place where those facilities want to locate, and we have a moral obligation to make sure that those residents get the same level of care and service that you or I might in the event that we have to dial 911. Ultimately, though, I know we talk about the money a lot with this referendum, and I get that this is a financial ask, but to me, it's about values. What kind of place do we want Fort Atkinson to be in the future? I've done a lot of research about fire department staffing models throughout the state. There are towns now in northern Wisconsin where literally they have to tell their residents, if you call 911, nobody may show up. If they do, it might take an hour or more. There are cities in northern Wisconsin that have had to tell surrounding townships, maybe not all of them, but 1 or 2, we can't serve you guys anymore. We just don't have the staffing. I don't want Fort Atkinson to get to that point where we might have to someday tell one of our surrounding townships, we just can't cover you guys anymore. We don't have the staff. Our paid on calls are too burned out. So that's really why this is happening. We don't want it to get to that crisis point. We want to be proactive and address this. So I really do hope you'll all take that into account when you consider how you're going to vote on April 5th. Thank you.
I will try to not take too much more of your time. And I was crossing things off so as not to reiterate things too much. For those on Zoom, this is Councilperson Megan Hartwick. Couple things I just want to mention that I've kind of mentioned at all of our meetings, but number one for me is talk to our teams. Talk to the individuals who are doing these jobs. That is where I started this process. I have only been on council coming up on a year now. And I wanted to get an understanding of this first from the perspective of those individuals who are actually doing this work. Who are the people out policing our communities? Who are the people who are leaving their kids' birthday parties and anniversary dinners with their spouses and their warm beds at 2 a.m. when it's negative 20 degrees outside to come respond to a call? What impact is that having on their families and their mental health and anxieties and their careers? Again, keeping in mind that all of these individuals have full-time jobs. We are very fortunate that a handful of our paid-on-call firefighters work for the city, because without that, our response to calls during the day, and Chief, please jump in if I'm incorrect in anything here, but if we did not have those individuals who work for the city who have the ability to leave their positions to respond to those calls, we would be massively understaffed for a lot of those daytime calls. That also then leads to some inefficiencies in other areas of our city departments, projects that don't get completed on time, work that has to stop midday because those individuals know we are that core group who can respond to these calls. That is part of the issue that needs to get addressed. But talk to our folks. I have yet to find a single one of them who isn't more than ready and willing to share their feedback and share their stories with us. We will have some more information coming out on that to the community for you to hear directly from some of those individuals. So I strongly encourage you to watch and listen to that information. I also just want to touch on, as Mason said, this is not a new problem. I've actually been pretty embarrassed and angry the more I've learned about this process to find out how not of a new problem this is. And the biggest thing right now is we're reaching a crisis level that we haven't quite been at before, but that we now have city leadership that was willing to take this on. This is not an easy task. These are not easy conversations to have. Not a single one of us wants to be up here talking to people about raising your taxes. I don't know anyone who is ever interested in having that conversation, but we are to the point where it needs to happen. That conversation needs to happen. And from our council standpoint, that was really, I think, collectively where we said, we're at least going to give the community the option to decide. We did not vote in this referendum. We are simply allowing the option for our community to decide whether or not this is something they want to support. You will also see this is not a Fort Atkinson problem. I know Mason mentioned some communities up north, Cambridge, Whitewater, other surrounding communities. You are starting to see these conversations happen. And again, as mentioned, I think we're just pretty proud to be a little bit more on the proactive side of it at this point, rather than we've had some really, really unfortunate situations happen and now we need to fix it. I also just want to point out, I've seen a lot of comments and feedback from people about, why haven't we seen a full cost benefit analysis of this? And for me, a couple comments on that. Number one that I've kind of already touched on. This is not a choice of one EMS over another. It is a much bigger conversation and a much bigger issue for us than that. EMS is something that is coming along with the proposed solution to bring revenue along with it so that we are asking less of our taxpayers to cover these differences. I appreciate that chart that has been added to the presentation because it shows what the ask would be if that wasn't coming along with it. So it is part of the conversation, but we are not asking voters to choose this EMS over this EMS. I think that message is getting a little bit lost. This is about fixing the staffing issues we have with public safety in Fort Atkinson. I struggle a little bit too with the cost benefit analysis because I don't know what the value is that you put on people not showing up to an emergency. When someone calls 911 because your spouse is having a heart attack or because there is a fire that started in your child's bedroom, what is the cost benefit? What is that number that you want to see on that side of what the expense of that is if we don't have a team or have a crew that shows up or that can show up enough in a timely manner to make it not as big of an emergency? And to me, that is something that I know it's hard to think about because I think the hope as taxpayers is this might be something that we would pay for that we as individuals would never need to use. And that's a hard thing, but it's something that we have to know that we have more stability and consistency with these services for our community going forward. And the last thing is, and I know this has been touched on, but the information is out there. I know Chris mentioned some examples. All of our city council emails are also available on the city website, as is every other leaders up here. Please do not vote if you still have unanswered questions. Please get those questions answered. Information is out there. We are readily available anytime to have those conversations with you. And let's chat. And if you have other suggestions or other ideas, if you want to give an example of something you've seen work somewhere else, those are great conversations to bring to us and for us all to have as a group. But right now, this is where we are. And this is not only the best and most effective solution, but in all honesty, it's also the most cost effective to address the issues that we are actually facing. So for those of you who seem to disagree, I'd be happy to hear of any other suggestions or ideas that you have. So I'm just appreciative that you guys are here. I think getting the feedback is great and seeing the active citizen participation is wonderful. So thank you.
Thank you again, everybody who was here in person as well as on Zoom. We are a little over time, so I'm going to wrap up our meeting. Please do check out fortatkinsonwi.net/referendum. That will get you all the information you need. You can email referendum@fortatkinsonwi.net if you have any questions. Our information is available on the website. You can be one of the 20 calls a day that I am getting on this right now, and I will gladly have conversations with you. So again, thank you for being here today. If you have any questions, we will be here afterwards as well. Thank you.
Thank you, everybody.